I'll just go through the steps. A lot of times the physicians are the ones that do most of this. Where you all can be really good advocates in the case is, unfortunately, until we get in there and measure how long it is from the inside gastric wall to the external stomach, we're not going to know exactly how long of a peg tube we're going to need. So a lot of times, if you know kind of the size of the patient, if it's a really large person, maybe in a car wreck, you're going to need a 4.4 centimeter or 3.4. If it's a really emaciated patient, 1.7 or 2.4 centimeter. And it says it really clearly on the box. They make all of the products mat proof, so I can't screw it up. So make it really easy. I'll just go through the tips and tricks of placing it and let you guys get on your way. So as you open up the box, you're going to have two sealed packages right off the bat. The first one is, if you flip it over, it'll have a trocar. This is a stoma measuring device. You can see the scalpel. And then this is set up for a sterile OR environment. So it is sterile. You open it up. It has the way that the devices are placed in here is kind of the procedural steps for what you all are going to do. So first things first, you open up this device package. It's got the dressing that you put over the patient after you take the ChloraPrep swabs. And unfortunately, because these are sterile, you can't put them in the package. So these are at the very bottom of the box. So you just have to open everything up, kind of pull the devices aside, and then you'll find these ChloraPrep swabs underneath there. And you guys all know, going an inch out, back and forth to clean the area. Put the dressing over it. The physician will then put the scope down into the patient's stomach, kind of look for that light, find an area where they feel comfortable making the insertion. And then from there, I've seen physicians do two ways, right? Like they'll kind of mark the area and then maybe even make the 1 centimeter incision on each side, or what's recommended is to actually place the trocar. And this is the safety trocar that we have. Simply remove the plastic sheath, push this stylet in to sharpen this trocar, and then you'll pop through and make the insertion. I'm going to show you guys, this is how it usually works. So we push in. I'm not trying to go through the plastic bag. And then here's how you actually measure. You extend your hand and open it just like you would any kind of endoscopic device, like a snare, biopsy forceps. You open it and it deploys a flange. So this flange is made to sit right up against that gastric wall. So you pull it back, and on the sides, right here, you can see it'll show you what marking and what size stoma device you'll actually need. So that's when, if you have a really thin patient, you may only see the 1.7. So that's when, if you pulled a 2.4, that's why you need to have that extra box. You just want to open this box out, another box, and grab, excuse me, the second piece, which should say 1.7 right here. And this is the piece, and you can see it's got the wire, it's got the tube in there. That's the piece that you need to grab. And then you can just replace the parts after the case is over, but just make sure you grab the right one. So after you've made the insertion, you've made the stoma, pull back, pull this piece out. Again, this is what sharpens the device, and so it's a safety feature for you all, and then discard it in the sharps. At this point, you're ready for the wire to be placed. So the wire comes in this little package. The physician still has the scope down there, and what you'll do then is just hand him or her the snare. That's the guide wire down. The snare comes in the package, or in the box, so you'll need to look for a snare, get one from GI. And this, again, this is all done through the scope. You'll open the snare up. Again, it's really easy, it's mat proof. Open it up. You want to feed the snare around the wire as close as you can to the end. Close it. You don't have to use the jaw grip of death on it. Just make sure it's nice and tight, because you're going to end up pulling the scope and the snare outside of the patient's mouth. Once it gets outside of the patient's mouth, just open the snare, pull it out, pull the scope out, and then you'll have this tube, which ends up being the stoma or the button. So you want to feed the big loop, which is the wire, through the small loop. Open it up and make a luggage knot by just pulling this tube back through the large loop. Pull it till it's tight. And then from this side, you want to remove, make sure the stoma measuring device is closed. Pull it back out and then take it off the wire. And then from there, all you'll do, the physician will just pull it all the way through. So I would usually give some lubrication at this point. This is why they usually make the insertion. The incision right here. Give it a little bit. Pull it all the way through to the patient so they can see. And what they're looking for is this red strip right here. And there's a little suture that's attached to it. So you want to pull that all the way outside of the patient. Grab it with a hemostat, forceps, whatever you got. And then just pull the suture all the way up. And then you will peel the plastic back. And what your end result should be is the stoma device. And now, again, the patient's going to be able to have that peg tube, get the enteral nutrition, their medicine, and everything through that, and still have it flat on the surface. Inside this device, there's the connectors. Now, has anybody heard about InFit at all? Does that come across the facility or hospital? So it's not a Boston Scientific word, it's an industry. The society that actually kind of makes the guidelines for enteral nutrition looked at it several years ago. Actually, they've been trying to do it for a while. So now we have these connectors that are just slip tips, right? It goes in, you slide everything in, put the medicine, and then you kind of put the rubber cap back in there. So what GESDA, which is a society, they want everything to be Luer locked, and this goes from peg tubes to enteral nutrition wherever throughout the hospital. So in July, you're going to start seeing facilities cross over to that. For now, you'll just have the connectors with the slip tips. But all of these devices right here are for the patient to take home. It's got the bolus connectors, so this just inserts to this one-step button, this low profile. It has the 60 cc syringe, and it has the connector, so the patient can use one for the medicine, one for food. And then from there, you know, if it happens to pop out or the physician does need to replace it, we do make replacement low profile buttons. It comes with a trocar similar to this. You would just insert it into the button. You elongate it. Again, usually you want to lube it up pretty well. It elongates, and then you would just pull this out. Usually this doesn't go right through it. There's actually a device made for it, but that's how you would replace it. And then on the flip side, you take the replacement button, put the trocar in there, push it, elongate it, lube it up pretty well, and then pop it back into the patient's stoma site, pull the trocar out, and then again, it's got a low profile button sitting on the patient's skin. Now these come in 24 French and 18 French. There's both on the shelf, so just make sure, I guess when you talk to the physicians or surgeons, what they want. So, any questions? Sure.
Are you going to be here whenever we start using these?
I think that the surgeons have been using them for about 3 months or 4 months.
Okay.
They started using them back in February. I know Dr. Quick did. Started using them in February. Dr. Kopenauer has started using them as well. Again, the surgeons, from what I've seen, are the ones that usually do almost everything, and they've got the attendings doing it most of the time. I write my name and number on the board. There is some, obviously with COVID, we've had to kind of change the virtual aspect of everything. So we've got some technology that we can do where you point your phone at what you need, and I can actually I can use my phone and then reach my hand around or draw on the screen live while you guys are pointing it at the device or the technology that you need help with. If I'm not here, right? Like if it's 2 o'clock in the morning, which is fine. I get it, you guys are on call, so am I. So I'll leave my name and number, and if you guys need anything, just give me a shout. But hopefully you'll start seeing me a little bit more and more as the facility opens up. told you I'd be quick.